So we are now going to start the second plenary talk. And the next one will be given by Professor Mauricio Baptista. He is a very well-succeeded chemist in the University of São Paulo. And he works a lot in designing new molecules, producing new photosensitizer. And beside that, he's collaborating with many groups in the university and outside the university, motivate them to do photodynamic therapy, to test new molecules, new configurations. So, Baptista, please, it's a pleasure to have you here, and I hope you can present us your talk.
Well, thank you very much for inviting me, Professor Donhato, and for trusting our work and for these nice words. I'm really honored to be here, and I hope I can pass to you the ideas and the hard work we have been doing the last years in our lab. So we have been working to define better ways to look for specificity of photo-induced process. So but I want to start showing the work of a colleague of mine, Professor Tardivo. This community in Brazil knows him well. And he's a medical doctor that really thinks of saving the patients using PDT. And there was a lot of discussion since the beginning of EPA about how we should proceed in terms of making the jump from clinical studies to real doctors using it as a practice. And I mean, that's the work Tardivo is doing I want to mention. And this is now trying to save the parts of diabetic feet. So these people tend to lose parts because of the amputation. Is the classical procedure. They give antibiotics to the patient, sometimes recover, a lot of the times don't, so they just cut the tongue. And this is, Tardivo designed a study to compare the PDT group that he performed PDT with the control group that was treated as classical antibiotic and if it didn't work, surgery. So this is non-randomized. It is not double-blinded, but it still was good because he could show that PDT worked much better than classical procedures. And the problem is he's trying to do multi-center study. He doesn't want to do double-blinded or, again, because he's not, he thinks it's unethical to allow people to lose parts. So he wants to treat all patients. But he wants to do it multi-center and still cannot find a lot of medical doctors that want to engage on this. So the other problem that we have, I think we need to face, is how to really engage more physicians on this. And so this is an open question. So how PDT can become more efficient, I think is the question the scientists, as we as scientists, should ask. More potent photosensitizers, synergic actions. We just had a very nice lecture from the nanoporphyrin. Thank you very much, Dr. Lan. I really enjoy it. And I want to show two examples of our group in which we mix normal photosensitizer with other molecules, and we do have synergic effects. This is the work of Agnaldo with Silvia, Marta, and Professor Humbling also participate on this. And they show that if they increase the amount of hydrogen peroxide in the treating microbials with methylene blue photodynamic therapy, you see there is a large improvement of the efficiency. And this was shown to be because hydrogen peroxide damages the membrane and allows more methylene blue to go inside. And we have recent data that Silvia obtained that she mixed methylene blue with urea, and in the presence of 2 molar of urea, there is a very large increase in efficiency, and the reason is because methylene blue urea is able to avoid dimerization of methylene blue. This is another example in collaboration with Professor Turro from Ohio State and my postdoc Christian. Is this okay? Thank you. So Professor Turro designed a lot of ruthenium complex, and some of them have photosensitizers that produce single oxygen. Some of them just have compounds here that under light excitation, it's able to bind and chelate DNA. And if you measure efficiency of cell death, this is on HeLa cell, this compound that has both the single oxygen and the chelation is much better than the one that only has single oxygen and much larger than the one that has only chelation. So these are two examples in which you can try to improve the efficiency by making it different mechanism of cell death. But the real question we think we should ask is how to improve selectivity. What are the mechanisms of selectivity? And I want to mention also on other work that has been presented here by this beautiful lady, Anseli. She works also in the Chemistry Institute, and she's supervised by Leticia Labriola, a colleague of mine. We are working together on this. And look at this data that she showed with three different cell lines. This one is for breast cancer. It's a metastatic tumoral cell line, and it responds really well for methylene blue PDT. So methylene blue is able to kill this cell line much more efficient than the normal one. And if you want to know why, you should ask her, because she has some hypotheses, but I don't have time to go into detail here. But just to show that with a very normal, very known photosensitizer, if you look well, you'll find some possibilities to study mechanism of selectivity. So what makes this respond differently? We're still trying to answer these questions. But we are looking for mechanistic selectivity to look for. So if you look at how people have devised new photosensitizers in the last decades, we always look for better absorption in the infrared, in the visible, so that there is better light penetration. So if you look, green doesn't go. If you put red, it goes really much larger. And the farther you go here, you have better penetration until certain limits that the infrared starts to be absorbed again. And the other thing we try to improve is the yield of single oxygen or radicals, whatever you want to choose is photoinduced here. And you can play with decreased aggregation, decreasing photon bleaching, increasing single oxygen quantum yield. You can put more oxygen, whatever you want. But this is always to increase the amount of single oxygen. And we asked ourselves some time ago, is this really a good way to go? Shall we improve this? Or is there other parameters we should look for? So we designed this study that we compared two photosensitizers that were well known. This is a good single oxygen generator. It's around 50% if you have oxygen, the quantum yield of single oxygen. And this is a very lousy photosensitizer. It loses a lot of excitation energy by vibration and rotation of these rings. So if you measure triplet yield, quantum yield, it's really much lower than 1%. It still depends on the cell type. If you treat them and put light, they kill cell. So can we compare these two? And so we did this in HeLa cell model, and this is survival curves in the dark and in the presence of light for crystal violet and methylene blue. This is the amount of dye incorporation, and this is a measure of photodynamic efficiency that is considered already amount of light that's being absorbed by these molecules that are intracellular located. So if you look at this crystal violet that is very lousy photosensitizer, under 1 micromolar concentration is actually better than methylene blue. And I'll show to you that the reason is because under this condition, methylene blue is being reduced inside mitochondria. But even if you increase concentration, like 20 micromolar, it's a lot already to treat cells with this. It's still, they behave the same in terms of efficiency of cell death. So we went to try to study why this was happening. So this, again, just to show that under these conditions, both cells were killed in the similar efficiency. But if we measure single oxygen from the methylene blue treated cells, it's much larger. It's 50 times more single oxygen than with crystal violet. This was supposed to be, but we had to check if inside the cell crystal violet would somehow produce single oxygen. No, it doesn't. So it's very low yield single oxygen. We should compare also other radical species. We measure dichlorofluorescent and other dyes that react with some oxidant reacting species. And in these conditions also, methylene blue does much better job than crystal violet. So the question remains why they behave the same in terms of cell death. And so we went to compare where are these compounds located inside the cell. And crystal violet, when we have the colocalization with rhodamine, that goes to mitochondria. It's 100% localized in mitochondria. So this is very hard to find. Anything that of these compounds that you treat cells with, I did already for almost 100 compounds. I only have 3 that have 100% localization in mitochondria, and this is one of them. Lysosome, crystal violet doesn't go there, doesn't accumulate there, doesn't accumulate in Golgi, doesn't accumulate in nuclear. Methylene blue, if you do the same experiment under low concentration, and if you want to try to understand where these compounds localize, you should use low concentration, and you see no emission from methylene blue. And the reason is because methylene blue is being reduced, and this is, we have other studies showing that. It's reducing so it doesn't absorb any more light. But if you increase, if you do the same with rhodamine, and here's the profile of rhodamine with no methylene blue, and you put a little bit of methylene blue, you see it changed the profile. It means that methylene blue goes to mitochondria but gets reduced there. If you look at lysosome under 20 micromolar, then you see a very good localization of methylene blue in lysosome, meaning that it does concentrate in lysosome, but it gets reduced in mitochondria. So what this young lady suggested for her thesis, and this work is published some time ago, is that although this is a much better photosensitizer in terms of producing species, reactive oxygen species, even in the intracellular environment, this works better because it goes to the right place. It produces a little bit of single oxygen and other radical species inside mitochondria. And this one, at low concentration, is inactive, and if produced, it doesn't work well in mitochondria. So, the question remains, can we improve the efficiency of PDT by improving selectivity? I think that work shows that we should search for ways to activate or inhibit specific biological routes. And that's what we have been looking for, especially to specifically induce programmed cell death. So I think some of you attend the lecture by this other beautiful lady. By the way, in the end, you may not like the science that I do, but you must acknowledge that I work with beautiful ladies. So I keep showing you that. So this is Tayana. She showed the work she did with comparing these 2 porphyrins. This accumulate most in lysosome, this most in mitochondria. She observed here apoptosis and necrosis, and here cell death with autophagy. So this is not new in the society, in the literature. We have very prominent scientists that have been working with this. Kessel is one of them, have done a lot of work, Agostini, Giori, Koshiver. So they have shown that you can play apoptosis and necrosis depending where the compound is and how amount of damage that you cause. Autophagy is a little bit later that came into play for PDT. And basically, if apoptosis is inhibited, the cell ends up dying, accumulating acidic vacuoles. So the autophagy process is induced, but the cell ends up dying. And this is especially true if the lysosome damage is occurring. So this is the work I'm going to show is from Naira. She just defended the master dissertation. And we wanted to show that it's possible to induce specific autophagy by playing where the damage is located. And she also showed this can lead to senescence, but I do not have time to show it now. So what is autophagy? Autophagy is a process of cell survival. So if you take any cell in culture and remove nutrients, the cell will try to survive by eating itself for some time. And so there is a programmed way to do that. People have studied this a lot. So there is engulfment of some organelles. You form autophagosome, and then you fuse this with lysosome, and then you form this autolysosome. That there is digestion and the material is released again. So cells have to maintain a certain level of autophagy to survive. Because if there is loss of autophagy, damage accumulates because these organelles end up accumulating damage, and then there is aging and cell death. If you have a lot, you have metabolic collapse and cell death also. So you need to find this steady state. So can we use PDT to change this and somehow allows cells to go through autophagic cell death? So we compare these 2 compounds that are very similar, methylene blue with dimethyl methylene blue. The only difference is these 2 methylene groups. And this makes a difference in terms of membrane binding. So this binds much better to membranes, and it damages membranes much better. So because it's included close to the double bond of the membrane, so it's much more efficient to cause damage in the membranes. But in terms of photophysics, it's basically the same. So where does this compound accumulate? So it does accumulate both in lysosome and mitochondria. So this is rhodamine 1,2,3, emission from dimethylmethylene blue, superposition. So you see here at 300 nanomolar, you see this compound. What it doesn't happen to methylene blue, because this is not reduced inside mitochondria, and does also accumulate in lysosome. Methylene blue I have shown to you before. 200 nanomolar, there is no methylene blue because it's being reduced, but it does accumulate in lysosome at larger concentrations, and also at 2 micromolar, you can see that it goes to mitochondria. So the sites of localizations are similar because both are positively charged, but this one doesn't get reduced in mitochondria, while methylene blue does get reduced. So what happens when we shine light? We treat the cells with these compounds, you shine light, both of them kill the cell, but the IC50 is totally different. Here we are talking about 4 micromolar for methylene blue, and dimethylmethylene blue, 10 nanomolar. So much lower concentration, we have cell killing in both conditions. The other difference is that these cells are being stained with acridine orange. Acridine orange is a compound that goes to acidic vacuoles. So this shows that these cells, they accumulate when they are dying a lot of acidic vacuoles, what is not happening with methylene blue cell killing. So there is a 200 and more efficient cell death here, and the mechanism seems to be different. So can we compare the amount of photo damage induced by photooxidations and the generation of single oxygen and so on? At very low concentration of dimethylmethylene blue, we cannot see single oxygen because it's very much lower than the amount we can detect directly, but we can use probes that measure reduction, misbalance of stress misbalance. And what happened if we compare here as a function of IC50, in dimethylmethylene blue, we almost see no difference. So we are going from control to 0.5 IC50 to 1 IC50, and these probes do not detect almost any change. And methylene blue, we do have to see increase in the oxidation, generic oxidation to have cell killing. So somehow, dimethylmethylene blue is induced a very small damage in the specific location that cannot be sensed by these probes. So the hypothesis I want to prove to you is that we need to have damage in mitochondria and in lysosome to induce a specific and efficient autophagic cell death, or cell death with autophagy. I'm not going into the differentiation of these two processes here, but to have autophagy and cell death. Okay, and I have some data that I want to share with you on that supports this hypothesis. So in terms of damaging lysosome, both dimethylmethylene blue and methylene blue cause damaging lysosomes. And here I'm comparing again the acridine orange that is staining lysosomes that are intact, and you can see as red here. After dimethylmethylene blue, you see no acidic vacuoles, and you see a little bit of methylene blue. Here is 2 micromolar, and here's 10 nanomolar. I'm always comparing the IC50, okay? So both cause damaging lysosome. We also have other data of cathepsin release and beta-galactosidase activity in the cytosol, and both data show that lysosome is damaged under both conditions. However, in terms of mitochondrial damage, we can only see mitochondrial damage under dimethylmethylene blue, and this is control dark, and if we shine light, here's 220 nanomolar, and we do see a very large substantial decrease in the intramembranal potential here, showing that the mitochondria was damaged in this process. However, for methylene blue, we don't see that. So there is, thank you, there is only damage in mitochondria of dimethylmethylene blue. And the reason is clear. The reason is because methylene blue is being reduced inside mitochondria. Although it's there, it's not photoactive. And this one, it is photoactive. And so in which step the autophagic flow is being inhibited. So in order to answer this question, we have to look at the proteins that are known to be present in the autophagosome and in the lysosome. And if we can see inside the cell that both proteins are on the same location, it means that there is fusion of formation of autolysosome before it's inhibited. And we are able to show that here's methylene blue. We can only see lysosome. We don't see formation of autophagosome because it's not induced autophagy in this condition. But for chloroquine, that's a known compound that induces autophagic inhibition. We do see formation of autophagosome, and then it gets stuck there. And the same happened with dimethylmethylene blue. So we know that autophagic flow is inhibited under this place. So there is somehow damage here and here by light-induced reactions, and then the system gets stuck in here. The hypothesis we're trying to prove is this: it needs damaging mitochondria and lysosome to have a strong and efficient autophagic cell death. And if that's the case, we perhaps should be able to transform methylene blue into this process if we cause an external damage in mitochondria. And then this is the experiment that we perform. So this is methylene blue. And we induce it damaging the mitochondria by hydrogen peroxide and rotenone. And we shine light. Methylene blue causes damaging lysosome. And we ask if under these conditions, the methylene blue would behave similar to the dimethylmethylene blue. And that was indeed the case. So this is the control, methylene blue alone, hydrogen peroxide and rotenone. These are very low conditions. The cell do not have any change in viability by this amount of hydrogen peroxide and rotenone that we use it. But it does have an increase in mitophagy. So it does cause some damage in mitochondria. So we induce this externally. And when we put these two together, and now we have cell death with accumulation of acidic vacuoles. And so this is another lady that worked with me, Valesca. She devised a way to quantify if the cells were dying by autophagy, a very simple process of comparing survival by neutral red with MANTT and CVS. This is the equation. This is published. And if the cell is dying with autophagy, and then we have increase in this AU, and this is chloroquine. This is our standard for positive control. Dimethylmethylene blue. This is the control without anything. With methylene blue, no much change. But if you have methylene blue with rotenone and hydrogen peroxide, there's an increase. So this shows that this methylene blue is able to cause autophagy cell death if you induce damaging mitochondria. And by chance, we have another compound, series of compounds that are not photoinduced. These are triterpenoid compounds, but betulinic acid and oleanolic acid, this is being tested as antitumoral. And by chance, we observe that this betulinic acid behaves similar to dimethylmethylene blue. It does cause damage in mitochondria and lysosome, and we have autophagic cell death. This is in the final revision, the scientific report. I hope it comes out very soon. So the conclusion from this part of the talk is that if you want to induce efficient cell death with autophagy, one way to go is to start the damaging mitochondria, induce mitophagy, and also inhibit autophagy by causing parallel damaging lysosome. So we can also play in ways to show that we can induce specific apoptose. I'll just show one example of our group. I already mentioned some other people did something different. This is also the work of Diana. She put porphyrin in DMSO. This is not very soluble in water, and she treated HeLa cells. This compound goes to the membrane. If you shine light, you damage the cytoplasmic membrane, and there is necrosis, incorporation of propidium iodide. But if you put the same compounds in the conservated nanocapsules, These capsules, they enter the cell by endocytosis. The porphyrin does not accumulate in the cytoplasmic membrane. The porphyrin is released inside the cell. We know that because we stain the nanocapsule and the porphyrin different, we can see that it's released here. And then if you shine light, we see a very clear apoptotic response. Caspase 3 response, cytochrome C release, and this is the response of the phosphatidylserine in the cytoplasmic membrane. Thank you. I'm just finishing. So I want to finish. I have some time for questions to acknowledge all the people that work with me. I'm partners. A lot of them are here. Professor Rita is not here, but she's been doing work with me. We apply for grants together for a long time, and FAPESP and USP for financing of this. Thank you very much.
Okay, so we have time for a few questions. I just want to say that we have a lot of room in front.
Very interesting talk. I enjoy it a lot. Question is, you mentioned a lot of different photosensitizers and also modifying agents. If I were to ask you, what cocktail of combination would you make as one of the best photosensitizers to deliver, so using our nanoporphyrin? What would you encapsulate inside?
Perhaps these people are better to answer. I would use something that does not aggregate. So we do have, because when you have these confined environments, the porphyrin it's planar, so it has a tendency to aggregate. I don't know if you are able to really make sure that there is no contact between two porphyrins. If you are sure of that, it's fine. But if you're not, there are some porphyrins that avoid aggregation. So they are they have some hindered group that even if there is some porphyrin close to the other porphyrin, there is no aggregation. Because when there is aggregation, you change the photophysics, and usually you have no single oxygen emission. So there are several examples in the literature, and we do have published one that is called L-type. So it's really, we can have millimolar concentration solution, there is no aggregate. But I would suggest that, if you go for red absorption is more efficient, and I don't know if Taibao or Humbling want to say something, because this is a question that belongs to you more than to me.
I think we've got enough good sensitizers. I think that there's not, so almost all of them good. I think it's the clever use that's going to make a difference. So I have a question. That first slide, that very impressive slide you showed about the amputation, was there maintenance done, or is it a single treatment that sort of did it? Was there a test of the recolonization in it?
Well, this is perhaps the most difficult part, because Tardivo has to do several times.
Yeah, sure. Yeah,
so it's usually is around 5 times.
Okay, so because the only other comparison of diabetic ulcers was done by the UK group, that company, and it returns. There's recolonization, so there's a beautiful response, but then there's recolonization in that. So
yeah, he has to do several times. Yeah.
Does the crystal violet and the methylene blue uptake?
Very similar.
Did you ever measure?
Yeah, this is.
It's similar.
We were able to compare because we compare the uptake. And it's crystal violet is a little bit larger, but it's similar. It's this data here.
Right. And did you use SOST for the singlet oxygen? What was the singlet oxygen measurement?
Yeah, we measure this time. We measure with the direct equipment, the emission in the infrared.
The slide that we showed about the combination methylene blue and hydrogen peroxide. Do you apply first hydrogen peroxide to pre-treat and then you enter with methylene blue? What is exactly the course of
Well,
action?
this was one of the experiments that we did to prove the hypothesis that if you treat first methylene blue and then afterwards hydrogen peroxide, it didn't work as well as if you do the reverse. Pre-treat with hydrogen peroxide and then methylene blue. But I think Agnaldo did the same. Most of the experiments he did together. But if you pre-treat with hydrogen peroxide, you're able to show the improvement. And if you pre-treat it with methylene blue, it doesn't have that improvement.
Have you tried that with dimethyl methylene blue?
We did not, but Mark Wainwright in the UK did. Yeah, he has data showing that. Very good for antimicrobial.
Okay, so let's thank again Mauricio for the nice
Thank you.
lecture. Okay.